Good morning. This is Dr. Deitcher's office, and I'm Cindy, one of his nurses, and I'm going to review with you step-by-step process on how to manage your drains if you should go home with one or two or more. The hospital will provide you with instructions, but we ask that you not follow those instructions, but to follow the ones that we provide for you in the office. In your information packet, you'll be given a step-by-step guide with documentation forms in the back, which I will review with you. Initially, I'm going to demonstrate to you what the drain actually looks like. This is the drain. You'll notice that there's a white component, and then there's an opaque component, and then a bulb. This is the component that is inside your body. It has multiple perforations along the sides and one straight down the middle. This opaque part is going to be the part attached to the bulb that will remain on the outside of your body. This will be stitched in place, so there's no chance of it coming out or slipping out or falling out. As you notice that this bulb currently is inflated, this is a non-functioning bulb. The only way to make this bulb functional is to have it compressed in the middle, put the tab into the little component part at the top. Now we have a functioning bulb with compression. This is drawing suction on the inside of the wound to draw away from the body the fluids that are going to be produced due to trauma and inflammation. It's plasma serum with white blood cells and red blood cells. Initially, the coloration of the drain is going to be a bright red to a medium red, and it'll progress to a darker red, almost to a tea color, extended down to like a light yellow urine color. So to manage these drains at home, it's imperative that we maintain very good hygiene. One of the main issues with any kind of surgery is infection, so we want to minimize that. The way we do that before you initiate any management of the drain is to wash your hands with an antibacterial soap, ensuring that you also brush underneath your fingernails, or you can use gloves if you find that would be easier. Wash your hands thoroughly, and I'm going to demonstrate as though this drain was inside a body, stitched in the center. The first thing you're going to do is you're going to grab an alcohol pad, and you're going to manage these drains while you are awake every 2 to 4 hours. And I'll explain what I mean by that. We don't want the perforations of these drains internally to get blocked with tissue remnants from surgery. So we need you to strip, or another term that is used is milking, the drains every 2 hours while you are awake. If you're sleeping, you do not have to do it. But when you are awake, we want you to do it. You'll take the alcohol pad, wipe the insertion side where the drain goes into the skin, and then wrap the 2x4 cotton alcohol pad, compressing it between your thumb and your index finger of your dominant hand. That's the hand that you write with, and support the tubing with your non-dominant hand. You'll compress your thumb and index finger down the middle and slide it down, holding it, moving your hand down to the lower position, and just causing and forcing the contents in the tube to go into the bulb itself. We want you to repeat that 3 times. Again, that's every 2 hours while you're awake. Every 4 hours, we want you to strip it again or milk it and empty the contents of the bulb every 4 hours. The only time we want you to do it sooner is if the bulb, when it is compressed, is filled halfway. The efficacy of the drain bulb itself doesn't work as well if it's halfway filled. So once you've done your stripping, you're going to pop the cap off of the drain bulb, and with the drainage hole, you're going to pour the contents into a little cup that we will provide for you. It has graduated markings of 30, 25, and 20, and so forth down the side. You'll pour the contents of the drain bulb into this little cup, set it aside, take a new alcohol pad, wipe the top of it off, recompress the bulb so you have now a functioning bulb, recap, and you're back to working for 4 hours, unless otherwise you need to empty it out sooner. If you find that once you've emptied the contents, there are remnants of tissue inside this bulb, do not put anything into that cap to try and get it out. Let it stay in there. The contents inside the bulb and inside the tubing is sterile, so we do not want you contaminating anything. You are good to go for another 4 hours. But once you've emptied the contents, you have to log them into our log sheets. because we need to determine when is the appropriate time to remove the drains. Dr. Deitch's protocol is once the drain has emptied 29 cc's or less in a 24-hour period, then we can remove the drain, but not before then. So we ask that every morning you select a time that works for your schedule, 6 a.m., 7 a.m., 8 a.m., 9, but don't go past 9 o'clock because you're gonna call the office and want to see if we can get the drains out. If it's past 10 or 11, it further delays your being able to come into the office and get the drain out. So earlier in the morning is better. So pick a time that works for your schedule and say that time every day, same time. Monday, Tuesday, Wednesday, Thursday, all the same time. If you think your drain has met the 29 cc approval to have the drain removed, you'll call our office, speak to the front office desk. We will review the numbers with you, and if it is appropriate, we'll have you come in and we'll take the drains out. We ask that when you do come with the drain removal, please bring your log with you so that we can double check to make sure it's safe for you to have the drains removed.